Good day, everyone. Welcome to the Foundation of Special and Inclusive Education. I am Kimberly Sabal from BS Ed Science 12A, students of Cebu Technological University. And today I'm going to talk about learners with physical disabilities. But before we proceed, let us know first our two objectives for today's video. First, to know what is physical disability, and second, to identify the different types of physical disability. So, learners with physical disability, we all know that in terms of learning, in terms of going to school, students with physical disability or physical impairment may have difficulty with managing the distance between different learning activities. So, with carrying materials, note taking, practicals, and may take longer to ask or answer questions. So, it's better that we know that when handling those learners with physical disabilities, we should know the strategies or the assessments that we can give to them so that they can learn, acquire knowledge in an inclusive classroom. So now let's continue to the physical disability. What is physical disability? So physical disability indicates any physical limitations or disabilities that inhibit the physical functions of one or more limbs to a certain person. So it can be permanent or temporary. So physical disability impaired by a number of conditions, some of which are permanent, some which are temporary. So these conditions include cerebral palsy, arthritis, muscular dystrophy, um, multiple sclerosis, Parkinson's disease, and repetitive strain injury. So this I had mentioned, this will be discussed later on. So, coordination and balance may be mildly or severely affected by any of these conditions. Movement may be impaired by muscle spasms or numbness or pain. So as a consequence, both manipulation of equipment and writing may be difficult. Some students use wheelchairs to enhance their mobility, while others will walk with the aid of calipers, crutches, or walking stick. Some students may experience chronic fatigue, and for others, there will be extreme fluctuations of energy from day to day. So, physical disability may also result from head injuries, including acquired brain injury. So, increasing numbers of students are returning to education following vehicle or reporting accidents in which they have sustained some degree of brain injury. Resulting impairment may affect speech, vision, or coordination, and the injury may also be responsible for personality disorders or depression. Now let's proceed to the different types of physical disabilities. So we have here the first, the acquired brain injury. So acquired brain injuries are due to damage that happens to the brain after birth. So they can be caused through a wide range of factors, including a blow to the head, stroke, alcohol or drugs, infections, disease such as AIDS or cancer, or a lack of oxygen. So it is common for many people with a brain injury to have trouble processing information, planning and solving problems. So they may also experience changes to their behavior and personality, physical and sensory abilities, or thinking and learning. So the effects of brain injuries and disabilities they cause can be temporary or permanent. So the second one, we have the spinal cord injury or SCI. So the spinal cord can become injured if too much pressure is applied and if the blood and oxygen supplied to the spinal cord is cut. So when the spinal cord has been damaged, it leads to loss of function such as mobility or feeling. For some people, a spinal cord injury results in paraplegia or loss of function below the chest, or others it leads to quadriplegia or loss of functions below the neck. So as well as affecting the ability to move through paralysis, it may affect many areas of person's body. So such as the cardiovascular and respiratory systems, bladder, bowel function, temperature, and sensory abilities. So now we have here the third one, the spina bifida. So spina bifida is the incomplete formation of the spine and the spinal cord in utero. So it can cause the spinal cord and nerves to be exposed on the surface of the back. instead of being inside a canal of bones surrounded by muscle. So people with spina bifida experience a range of mild to severe physical disabilities, including paralysis or weakness. So in the legs, bowel and bladder incontinence, hydrocephalus, or too much fluid in the brain cavities, deformities of the spine, and learning difficulties. So the cause of spina bifida is not well understood, but it is like caused by genetic and environmental factors. So adequate intake of folate by the mother in early pregnancy has been found to be a significant factor in preventing a child developing spina bifida. Now, cerebral palsy. So cerebral palsy is typically due to an injury to the developing brain before or during birth, caused by a reduced blood supply and lack of oxygen to the brain. So people with cerebral palsy may experience weakness, difficulty walking, lack of muscles control, problems with coordination, involuntary movements, and other symptoms. Cystic fibrosis or CF. So cystic fibrosis is an inherited genetic condition which affects the body respiratory, digestive, and reproductive system. So it specifically affects the mucus and sweat glands in the body, causing mucus to be thick and sticky. So people with CF can also have low salt levels in the body, which causes problems such as fatigue, cramps, and dehydration. So now we have here epilepsy. So epilepsy is a neurological condition where a person has a tendency to have recurring seizures due to a sudden burst of electrical activity in the brain. So seizures can cause unusual movement, odd feelings or sensations, a change in a person's behavior, or cause them to lose consciousness. So the causes of epilepsy are not always known. However, brain injuries, stroke, cancer, brain infection, structural abnormalities of the brain, and other genetic factors can all cause epilepsy. Multiple sclerosis or MS. So MS occurs when the myelin sheath, a protective tissue around nerve fibers in the body, becomes damaged, causing random patches or scars. So the scars can interfere with messages sent through the central nervous system, affecting the brain, optic nerves, and spinal cord. So the symptoms of MS are very varied but can include fatigue, loss of motor control, tingling, numbness, visual disturbances, memory loss, depression, and cognitive difficulties. Now, let's proceed to the muscular dystrophy. So muscular dystrophy is a group of genetic disorders that lead to progressive and irreversible weakness and loss of muscle mass. So there are more than 30 different types of muscular dystrophy, and each has a separate cause. Signs and symptoms can be varied, however, can include difficulty walking, trouble breathing or swallowing, restriction in joint motion, and heart and other organ problems. Now we have here the Tourette syndrome. So Tourette syndrome is a neurological disorder which involves involuntary and repetitive vocalization, sounds, and movements called tics. So these tics are neurological, not behavioral, which means a person with Tourette syndrome cannot control them. So there are two types of Tourette syndrome. We have, two types of tics. We have the vocal tics and motor tics. So when we say vocal tics, it can include sniffing, throat clearing, tongue clicking, grunting, or more rarely blurting out socially unacceptable words or phrases. And when we say motor tics, can include eye blinking, shrugging, nose twitching, head jerking, facial expression, touching objects or people, spinning around, imitating someone else's actions, or jumping up and down. We have here the last type of physical disability, the dwarfism. So dwarfism is a short stature abnormal skeletal growth, which can be caused by over 300 genetic or medical conditions. So it is generally defined as an adult height of 4 feet, 10 inches or less, with the average height of someone with dwarfism being 4 feet. So children with dwarfism also may experience a delay on developing motor skills. However, dwarfism does not have a link to any intellectual disability. So now let's proceed to the impact of a physical disability. So the impact of physical disability on learning will vary, but for most students, the issues of most significance relate to physical access, manipulation of equipment, access to computers, participation in field trips, and the time and energy expended in moving around campus. So these are the types of the impacts. These are the impacts of physical disability. So first we have, when there is a limited time to move between venues, students may miss the beginning of class. So it's better that the venue should stay at one place so that those students with physical disability will feel comfortable and won't miss the beginning of their class. So the second one, fatigue is common for many of these students. So using facilities that others take for granted, such as toilets, food outlets, libraries, and lecture rooms, may be a major undertaking. So some students also may experience function difficulties, so an inability to write using a pen, reduced writing speed, involuntary head movements, which affect the ability to read standard size print, and reduced ability to manipulate resources in the living learning environment. So they may have difficulties turning pages or using standard computers. So students may have frequent or unexpected absences from class owing to hospitalization or changes in their rehabilitation to treatment procedure. So earlier periods of hospitalization may have meant gaps in schooling. Now, next, students with a long-standing mobility disability may have experienced gaps in their schooling due to periods of hospitalization. So this may have affected their confidence in learning. So students with mobility impairment may have fewer opportunities for interaction with other students. So feelings of separateness in the learning environment may have an impact on learning. So now let's proceed to the teaching strategies for the learners with physical disability. Here are some teaching strategies. So, the first one, we have students who use wheelchairs, calipers, or crutches, or who tire easily may find it difficult moving about within the constraints of lectures timetables. So, absence or lateness may be a result of the distance between teaching venues. So, at the end of lecture, you may need to recap any information given at the beginning. The second one, check that academic activities which take place off campus, so such as industry visits, interviews, or fieldwork, are accessible to people with mobility or disability. So consider supplementary laboratories, practicals, films, or videos as alternative options to field trips. Third one, students with mobility disability may sometimes wish to use their own furniture such as ergonomic chairs or sloped writing tables. Extra space may need to be created in teaching rooms, but this should be done unobtrusively. So, some students with back problems also may prefer to stand in lectures or classes rather than sit. So some students may need to use a tape recorder or note taker in lectures. So extra time is involved in processing informations acquired in this way. So it is common practice in some departments to routinely tape all lectures. So this is practice which will assess a variety of students, including those who may be absent from time to time because of their disability. Students also may need extensions to deadlines for work involving locating and using library resources. To provide reading list will be before the start of a course so that reading can begin early. Academic isolation may be an issue for students who are unable to participate in some class activities. So one-to-one sessions with a tutor may help fill this gap in participation. These are the assessment strategies. So we have here the first, a reader or an oral examination, either presenting answers on tape or participating in Viva, are alternatives to the conventional written paper. So an oral examination is not an easy option for students. So give the same time for an oral examination as for a written exam, but allow extra time for the student to listen to and refine or edit responses. So in your assessment, allowance should be made for the fact that spoken answers are likely to be less coherent than written answers. The second one, for some students, the combination of written and oral examination will be most appropriate. So allow students to write answer plans or make outline notes, but then to answer the question orally, your assessment should be based on both the notes and the spoken presentation. Third one, students may need to use a personal computer or a personal assistant in an examination. If so, it may be necessary to provide extra space for equipment or a separate examination venue if the noise from equipment is likely to be distracting for other students. Now, the provide extra time in examinations for students who have reduced writing speed. So some students with a mobility disability may need rest breaks. So take home examinations and split papers may be options. So given that some students may need double time to complete examination. So and allow extensions to assignment deadlines if extensive research involving physical activity, such as frequent trips to the library or collection of data from dispersed location, is required.